I'm Dr. Priyanka, Medical Officer of the Institute Hospital NIT campus. I'm here to elaborate on a few tips that would be helpful for you people, especially while on campus during this COVID pandemic. One main thing that I want to reiterate is that I want to be the take home message after this session is COVID is not over yet. What we feel from the medical perspective is people have started getting diluted with the COVID appropriate behaviors. I understand it was a tough time for more than 8 months during this lockdown period where all our routines have changed and we are confined within four walls. But now that we slowly begin to resume to new normal, the only one thing that we should keep in the back of our mind is COVID is not over completely. What the WHO says is a pandemic usually takes on an average 2 years to get back to normal. So I would say we are halfway through. So, with this in mind, let me brief upon a few COVID appropriate behaviors that is advised by the Ministry of Health and Family Welfare. What the Health Ministry says is we all need to make a set of 15 promises to follow as a part of COVID appropriate behavior. We will see it one by one here. So, first and foremost, as we all have been seeing and hearing in all media and paper, is social distancing. So, greet without physical contact, especially when you are back to campus. Again, you are put into quarantine 14 days, no contact. Once you are open after quarantine, please keep in mind the more you follow COVID appropriate behavior, the safer that you and your friends will be. So keep this in mind always. Greet without physical contact. Maintain social distancing at all times and all places. I would say this 6 feet distancing is strictly followed in office atmosphere. But rather than that, when you are in campus, especially in the hostel, in the mess, after successfully completing your quarantine period, we are happy. You are also happy. But again, keep this 6 feet distance even in the mess when you're dining, even when you are around with your friends. Try to connect virtually and not physically. So, this 6 feet has to be there always. Whenever there are two persons in a room or in the hostel or in the mess, ensure there is this 6 feet distance between you both. Of course, having said that, in public places, it is very obvious that you should strictly adhere to this 6 feet distance, especially when you go out to shop for buying essential products to the vegetable or fruit market, pharmacy, hospital. So, anywhere there can be asymptomatic carrier of COVID, or even you may get infection from healthcare workers too. So be cautious wherever you are. Nobody is safe. Nobody is immune to the virus. Keep it in mind always. I would say rather prefer getting products home delivered. Even in the campus, I believe they have extended this facility. You can get the essential things home delivered to your hostel rooms. So, in case if it is absolutely essential, you can step out, but again, keeping in mind this precautionary behavior. And in your office, in your lab, when you're working together, please ensure this minimal distance is followed because if the other person is infected, their physical contact may increase the risk of transmission. So when we do this contact tracing, primary contact, we find out the first thing what we ask is who did not maintain social distance, who had physical contact with each other. They all will be grouped as primary contacts. So you should not become primary contacts to any infected person. So the third promise what we are all going to make is we need to wear face cover or face mask at all times. So I would like to highlight this point. Now that mask is almost like one accessory that what we wear. It's like a lifestyle. It has become more like a lifestyle. But the point that I want to stress here is how you are going to wear that mask. Mask is again a barrier that would protect you from the virus. So the first point what you see here is wear the mask so that the nasal clip is over the nose and external pleats should face downwards to have maximum coverage and protection. Second point is please ensure it should cover your mouth and nose. Otherwise, there is no point in using the mask. Third point is tie the strings properly. There should not be any gap between your face and the mask. Air leak should not be there. And please do not touch the front of the mask. Virus is invisible, so you may assume that the mask is clean, but it may not be actually. So please avoid touching the mask when you have worn it properly. While removing the mask also, untie it properly only by touching the strings. Soak it in, if it is a cloth mask, soak it immediately inside soap water or hot water. Wash it then and there, dry it in sunlight and then reuse. If it is a surgical mask or a disposable mask, do not reuse it. It is not designed in a way to protect the virus for repeated use. So please dispose it in the proper way in a closed bin. Do I need to wear a mask all the time? So remember three key occasions where you should definitely wear a mask. When you undertake any essential travel, for example, you're commuting from your place to the campus or you're moving around in the campus. So wherever there is a travel, you have to wear a mask. When you are in a room with other people, two people in a room, please put on your mask. When you have any signs of cold, cough, or flu, you rather choose a surgical mask than a cloth mask. So, in our campus, I find it is being followed very diligently. So, whenever you step out of your room or your house, please ensure your mask is on. The next point is wash your hands. I think SMS has become a fancy abbreviation now. Soap, mask, and social distancing. So third thing is washing hands with soap or alcohol-based sanitizer. Wash your hands thoroughly. Follow the 6 steps of hand washing: palm to palm, back to palm, your fingers, interdigital spaces, nails, and thumb. All areas should be lathered sufficiently with soap and then wash it thoroughly to ensure good hand hygiene. The fourth promise is please avoid touching your eyes, nose, or mouth. So the virus doesn't spread only through your nose or mouth. Having covered it with a mask, we also should be conscious that even a casual rubbing of the eyes can make us more prone to the infection. So please don't touch your eyes, as the conjunctiva of your eye is also capable of transmitting the infection. You can wear a plain specs. It has become very commonly available now. So a powerless specs or a plain COVID protective eye gear you can have for additional safety. So let's be extra careful. Why? Again, hands, you may be touching your hands in any place, for example, a doorknob or a table where another person would have seated or would have handled that area. So, if your hands get contaminated, you may easily transmit the virus to you. The fifth point is we all have to maintain respiratory hygiene, especially when now due to the rain we find lot of patients coming with common cold and cough. It need not be COVID always, but whenever there is any infection, seek medical advice. While coming to the hospital also, you cover your nose and mouth with a tissue or with a handkerchief. You'll have to cough it. If you don't have a tissue or a handkerchief, please cough or sneeze into your bent elbow, not into your palms. Again, that may be a route of transmission of infection. And wash hands more frequently if you are sick or if you have any respiratory illness. The sixth promise is when you wash your hands, do it regularly and thoroughly. Literally, your safety is in your hands. I would like to stress on a point that both soap and sanitizer are equally effective in protecting against the virus. So, sanitizer is not superior to soap. Only advantage is that it is handy and you can use it even when water is not available. So, the seventh promise is we all should ensure frequently touched surfaces are cleaned and disinfected properly. For example, if you are in a lab, if you are going to use a computer, I'm sure all the labs have a sanitizer bottle or a spirit bottle there. So kindly see that your work area is sanitized completely before you begin your work. And try to keep the environment also hygienic and clean. The regular mopping and cleaning of all your departments and hostels is done with the chemical disinfectant to ensure the hygiene is maintained. The eight promises, of course, we should avoid spitting in the open because again it increases the risk leaps and bounds. And of course, spitting is also punishable by law. The ninth promise and a very significant one is avoid unnecessary travel. This we have been very strict and cautious, I would say, few months back. But now, as we go to the new normal activities, we find traveling is not so complicated as before, or that the transport is open up. We find it more casual, but it's not really so. So, avoid unnecessary travel even if it is a local travel within the city or if it is traveling from one station to another station, do it only if it is absolutely essential. And if you do step out of your house, you should wear your face guard and follow social distancing norms. The 10th promise is do not discriminate against anyone. See, COVID 19 is just a normal viral infection. Only thing it is novel. So there is lot of fear and confusion around. So even if somebody is infected with COVID, please be compassionate and supportive to them, be it your colleagues or your family members or anybody known to you. It can affect anyone. So try to support them in all possible and in all safe way. I would say, especially when you are down in campus or away from your home, you should be extra cautious because hostel zone, again, you will be staying together as a group of people, though you are in individual room. So, my advice is keep a check on any health issues or symptoms. Earlier, we were finding only typical symptoms like cold, cough, breathing difficulty, loss of smell, loss of taste. But of late, there are atypical symptoms of COVID 19 too, like a simple diarrhea or vomiting or extreme body pain, tiredness, or a prolonged headache. All these can be symptoms of COVID too. So, if you find any health issue or any sort of unusual symptoms, please seek medical assistance immediately. In the campus, the Institute Hospital offers teleconsultation facility too. So if you or if your friends note any health issues, kindly feel free to contact 24-hour help desk of the hospital at 3860 and take medical guidance over phone. And here, we would also like you to download and install the Arogya Setu app in your mobile. The app has got inbuilt feature. I think many of you would have done it already. If few of you haven't downloaded it, please do it now. Even if you're in your home, you can just check your health status. It also assesses the risk around you. The places where you have moved on, it tracks it and shows the risk status. So it will be very useful. Of course, I've seen many students doing this, boost the morale of doctors, nurses, police, sanitary workers who are on guard 24 by 7 to protect us. Yes, of course, it's a bit tiring, but still, we are here to save you. We just want you to help us to help you. So it's time to show care, compassion, assurance, respect, and encouragement. More than that, we would be happy if you follow COVID appropriate behavior and stay safe, especially while in campus. The 11th promise is discourage crowd, encourage safety. So, what is told now is more than four people is a crowd. So, all the definitions are redefined. So, please don't form any physical groups. We have lot of facility. You can connect virtually. You can form groups. You can form teams. You can connect to your friends. You can connect to your family. No physical gatherings unless absolutely essential. This also of late, I would say, we have found there are a lot of clusters of COVID, especially post events. For example, after a wedding, after a funeral, after attending some party or gatherings, the risk is more. So please say no to gatherings as far as possible. If some event is absolutely essential, please ensure the number of guests are kept to the bare minimal and all the promises that we saw so far are followed strictly. Yeah, have you tried connecting with your loved ones and colleagues virtually? I believe yes, of course, all of you would have done it. It is much safer. One significant promise is do not circulate social media posts which carry unverified or negative information. We see lot of fake news and cooked up news in social media creating panic among people. So verify the authenticity of any information that you share. And uh, where do we get authentic information about COVID 19? The national portal of the Health Ministry is www.mohfw.gov.in. So, this gives authentic and up to date information on the number of COVID cases or the precautionary measures advised by the government for colleges, the SOP, everything is available in this government website. There are national and state level toll free helpline numbers. 1075 is the national toll free number. And of course, in the institute, you can call the hospital 24 by 7 to get authentic local information because the COVID protocols and the follow-up measures differs from place to place. So in the campus or in and around the campus, you can very well call the institute hospital. Our staff nurse and duty doctor will be happy to guide you all the time regarding any COVID-related query. You can contact the toll-free number if you have any symptoms related to COVID too, and as well as the hospital. We do have a list of centers where the testing is done, where you can take the proper assessment. Everything you will be guided on individual basis. One vital thing is please do not hesitate to disclose your symptoms. There is a lot of stigma around. What if people know that I have infection? Please don't think that way. The earlier you seek help, the faster you will beat the disease. Fortunately, younger people they don't get severe infection very commonly, but still we do find the younger people also going for admission with lung involvement. So we can't predict who will recover completely and who may need some extended medical support. So, without hesitation, please disclose your symptoms so that we can attend you at the earliest possible. Seek psychological support in case of any distress or anxiety. I think this is the last promise, 15th promise. but it's a very, very significant one. And not only with the symptoms, this lockdown itself has put lot of pressure on many people, not only students, in the general population as well. So, in case of uh, any distress, feel free to seek psychological support. I would like to mention here that inside the campus, we have an institute psychologist along with the Your Dose, the online counseling portal, where you can seek help based on your need. They will assist you and try to keep you in a comfortable way as much as possible. Coping with any public emergency can be a testing time for people and their families, both affected or unaffected. So do not ignore or suppress any feelings of anxiety or distress. We are all humans. Anybody can get upset anytime. And of course, with such a long period of lockdown and change in your routine, you might have to complete your academic work. That pressure may be there in the back of your mind. You will be staying away from your family. Whatever it is, feel free to talk to us and seek help without hesitation. There is a national psychological toll free helpline number also. You can note it down 08046110007. So teleconsultation facility is available. Rather than that, for the campus, your dost and the counseling services given by Mrs. Josephine is there. Institute Hospital can also extend counseling facilities whenever required. So together we will fight COVID-19, and we need your support and inputs in order to help you better. So I strongly believe our campus will be a safe place to all of you with all your support. Again, take home message. What I want you people to remember is just one point. If you remember, COVID is not over. Till January end, we are not sure whether we will be getting second wave in Trichy, in Tamil Nadu. We are not sure. Vaccine we are expecting by next month, but again it will be prioritized. Frontline workers, the security people, all the warriors, and then the elderly people, the diabetic, and then only it will be given to the youngsters. Again, efficacy is we are not very sure of. So please keep in mind, COVID is not over completely. It has not vanished. It is still there. With these simple steps, we can stay very, very safe. Yeah, that's all. Thank you. If you have any doubts or any queries, you can please mail us to hospital@nitt.edu, and we'll be happy to clear your doubts. Thank you.